I grew up in a very multicultural environment. Faith and church were sort of the center of my world as I was growing up. And I grew up in a military family. There's a picture of my grandfather. He was a Freemason, but he was also enlisted and fought in World War II. And then there's my mom, who is in that picture there. She was an accountant and worked for the government. And so I come from a family of civil servants and a military family. My father was also in the Air Force. So some of my research training and professional experience. So I did my undergraduate studies at Morgan State University, which is a historically black college and university in Baltimore, Maryland. And during my time there, it was really rich being at that state university. One of the things that I really encourage students is to really seek out those relationships with their professors. I was able to do that. And while I was in Baltimore, I was able to work at Johns Hopkins School of Medicine. I worked in a phospholipids lab. So I ran gels and did bench science research for a summer. And then for a couple of years while an undergraduate, I was also a research assistant at Johns Hopkins School of Public Health. And I worked on a violence prevention project at the time. And then during my senior year summer, I was able to apply to the Minority Undergraduate Students of Excellence, so the MUSE program, and through the American Psychological Society. And I spent the summer doing research with about 20 other students from all around the country at the University of Delaware. So your undergraduate years are a great time to explore different experiences and find out what you like and what you don't like. So I moved on to my graduate training in the greater Washington, D.C. area. I ended up going to graduate school at Uniformed Services University, which is in Bethesda, Maryland, so right outside of Washington, D.C. And I received my master's degree and my PhD from the Herbert School of Medicine at Uniformed Services. I was a predoctoral fellow for 3 years with the Ford Foundation, which was a transformative experience. I met many lifelong colleagues and friends through that experience. So, apply for as many things as you can. And I also had a graduate fellowship with the Henry M. Jackson Foundation for my last year. And one of the things that was really exciting, my grandfather is from a very rural part of Alabama. And the highlight was him coming up to my graduation. That's my graduation there. He's standing there with the suspenders on in the front. And he just couldn't believe it. As a World War II survivor, the fact that I was finishing, he was able to come to DC and take a picture in front of the World War II monument and was very, very proud. So there's usually an army behind every single person as you're going through your studies. So make sure that you take the time to reach back to them because they are just as excited. The final thing in my training is I did a 1-year postdoctoral fellowship in cardiovascular behavioral medicine. And I ran a family intervention study of health called the FISH study. And we worked with families, so moms and kids, around healthy eating for the year of my postdoc. And so most of my professional career has actually been in the greater Philadelphia area. So I have, when I came to Philadelphia, I worked for a number of years with the Center for Health Equality at Drexel University. It was a new center that was just beginning. And I was a senior research and policy analyst. And in that role, I experienced so many great opportunities that were so different than my training in psychology. It really got me interested a lot more in public health. So, I think opening yourself up to try different opportunities is always a great thing to do. One of the things that I learned from working in that center was just the operations of working with a team of people that were really focused on health issues not only at the sort of the research level, but looking at policy issues and how policy affects how individuals are able to really to affect change in their own lives. So then I was an assistant professor in the Department of Health Management and Policy at Drexel for a few years. And at that time, they were starting a new doctoral program in health policy and social justice. So I chaired a couple doctoral dissertations and worked with about 40 different master's students for their master's thesis in that department. And I was a research mentor for a number of years for graduate students, medical students, and law students that came to work to understand more about research. And then I sat on the graduate admissions committee for a number of years. So I reviewed many graduate school applications. And so I've had that experience. And so that was great to see what students do during their undergraduate years that lead them to want to continue further doing research and further going on to graduate school. And then more recently, I've been at Rowan for the last 3.5 years. And my impetus for coming to Rowan was because I wanted to be at a state university. I had great experiences as an undergraduate at Morgan State University, and I know how transformative that can be. And I wanted to work on the new undergraduate program in community health and public health and wellness, which was launched in 2017 when I came to Rowan. And so I've been able to work with a number of different students as I've continued my work here. I've worked with graduate students in the dietetics program, medical students at both of the medical schools, and I have appointments at both of the medical schools. So my career has been long, but more time to come. So for the last 19 years, I've been working in community-based participatory research projects or community-engaged research to really look at health issues for racial and ethnic minority communities, as well as urban and rural communities. So I've been able to work with county health departments, I've worked with city health departments, I've worked with state health departments, I've worked on some violence prevention work, which I'll talk with you about. I have also worked on, more recently here at Rowan, food insecurity in college students, so diabetes education programs, and food quality and food access issues, and also translating evidence-based interventions into community settings is my main area of focus. And so I show you these projects just to show you that your career journey can take you in many different ways, and each of these projects I've learned a tremendous amount from working over these past 20 years. So section 3, I'm going to talk a little bit about what translational health disparities research and public health are. So one of the things that I think is very important is to know your why. So why are you doing the work that you're doing? And if you can understand that at a very at the very core of yourself, then it'll make your work over your career very enjoyable. So the social determinants of health are those conditions in which people are born, grow, live, work, and age. So it's everything that's around the person that helps to promote health. And when we talk about the social determinants of health, we realize that they're really shaped by a lot of different things that actually aren't necessarily social. They're actually a bit political. And so there's some new work out of Harvard that's talking about the political determinants of health, because these circumstances that people grow, live, and work and age are affected by the distribution of money, power, and resources at every level, at the global level, at the national, and at the local level. And in many of my classes that I teach in the health and exercise science department, the faculty and I always talk about the socio-ecological model, and that you're shaped not only by your individual behavior, but the environment around you. And so public health is really focused about all of those things that are around you that help you to be able to achieve your optimal health. And so the social determinants of health can be responsible for health inequities. And so when we talk about health inequities, we're talking about what's unfair and avoidable in terms of differences between individuals. So my additional why, when I was in graduate school, sort of towards the end of my graduate school training, this landmark report came out by the Institute of Medicine talking about unequal treatment. And it talked about that racial and ethnic differences are not really due to just access factors. It's not just about people having access, but when you control for all of the factors that a person has for seeking care, if you control for socioeconomic status and insurance and clinical need, then what's left? And it's a lot of these social determinants of health. It's a lot of these other issues in terms of policy. And this report really sort of changed my thinking and what I wanted to do for my career. And I was in DC at the time, and so this made a big splash in that we really need to think about these issues a little bit differently. And I just want to take a step back. So during my master's thesis, I was able to begin to sort of think about some of these ideas, because one of the things I was able to do was do a study focused on understanding health disparities and symptoms for diabetes in the military population. So access wasn't a factor because all of the military have access to the same exact high quality care. And so we did find differences by race and ethnicity in my master's thesis. And so that led me to start to think, what's really going on here? So as you know, from my background, I said, my training was in psychology, but over time, I was sort of getting these inklings of public health. I didn't really know that at the time, but that's where I was sort of moving towards public health in small ways. So health disparities and health inequities are key to the work that I do. And we understand health disparities as the difference in health care and health status between different population groups. And we think of them as systemic, avoidable, and unjust. This quote by Martin Luther King talks about how of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. And so that is really sort of what resonates when you think about health inequity and injustices related to health and how we go about trying to work to improve them. So my why and the way I wanted to go about doing this was really influenced by Dr. Barbara Israel, who, when I was at the very beginning of graduate school in 1998, published this paper around the community-based participatory research principles, and really talked about partnering with communities in a really authentic way in order to make sure that what we're doing no harm, and what we're doing is really situating the community in a way where future gains and future improvements can be made. And so these principles, I usually talk about them in many of my presentations, because it really is my orientation to how I do the work, and making sure that these principles sort of run through, making sure that the work is equitable, that there's co-learning and capacity building along the way, that the partners are really a part of this work from the very beginning, and that we're thinking really strategically about how we can sustain this work after the projects are over. So this really talks about the importance of translational research, and sort of it sort of frames my trajectory really well. It's sort of a health disparities research framework, but it really sort of talks about sort of my training as a social scientist, as a psychologist, was really rooted in understanding the underlying causes, that clinical intervention. So I do a lot of intervention-based work, and then really thinking about prevention. So public health research, and thinking about ways that we can move people towards prevention over time. So in all of the work we're doing, we are allowing the community members to really become involved and take action in a lot of this work, and making sure that we're recognizing that their values and the respect for their needs are being met because they're really driving the work. They're working with us, alongside us at the same time, really making sure that what we're doing and the questions we're asking really make sense to what is going to effectuate change in their lives. So my research career prior to coming to Rowan, I participated in so many projects. One of the things that this section will talk about, I'll just talk about a few of the key projects, but there's many, many more research projects that I was involved in and have published papers with colleagues, both community and academic. But these are a few highlighted projects. So one of the first projects I worked on when coming to Philadelphia was actually working in hair salons in North and West Philadelphia. And we were doing some asthma and diabetes awareness in a number of neighborhoods. And this was funded by Arthur Ashe, the famous tennis players foundation, his Institute for Urban Health out of New York. And we were able to replicate a study that was done in North Carolina, where we were working with beauty salons and hair stylists to be educational or health coaches. And so we were able to work with the hairstylists to run some short videos while people are there waiting to get their hair done. And then we were able to do some surveys and found that the hairstylists really enjoyed working with people and talking about these types of health conditions with people with some training. So we published that work if you want to see that. Another project that we worked on, I worked on for over 5 years, working on a project that was funded by the Center for Disease Control and Prevention in Atlanta. We worked on the Philadelphia Collaborative Violence Prevention Center, which involved a number of organizations and institutions. The lead partner was the Children's Hospital Philadelphia, and then all of the universities, so Temple University, Drexel, University of Pennsylvania, all worked together on this project. And we were working to really prevent violence in the city and work with after-school programs and in churches and school settings to really outreach to the community on prevention. So we had a lot of recruiting efforts. We hired individuals from the community that worked alongside of us and to do this work. We were able to produce a number of great deliverables. We were able to work with youth on drawing contests about violence prevention. We were able to have the youth work and become reporters for the newspaper and talk about violence prevention. We were able to put a training program together for them. So you see them there sort of graduating with their certificate. And again, this was co-learning and capacity building. So many of the youth were learning strategies that they could use not only in this project, but later on in their life and in their career. So that's sort of the hallmark of community engaged research, is that you're making sure that the deliverables are happening while the work is happening. We did some focus groups with youth, and the youth helped us design this flyer. And some of the themes that came out of those focus groups were that the youth were interested in having access to media. They preferred sort of visual messages around prevention, and they preferred digital animation. So we took the results of that focus group and we began to work on an animation project. So this is us here working with a group of youth in the community to develop realistic scripts and to cast them as the actors in our animated series that we created. This is us working with an animator. So the animator also talked about different job paths and different careers in animation and digital design. And so there we are teaching the youth again and working along with them to make sure that they have opportunities that they can use in their career and in their life as well. And so we created a youth advisory board and we worked with that youth advisory board that you see there to create these characters that ended up becoming the brands for the work that we did. And so this is all influenced by the designs that the design feedback that we received from the youth. and they told us sort of the names of the characters, and you can see from the beginning how we started, and then over time how the characters evolved to become branded for this violence prevention project. We then held a very large community symposium in West Philadelphia, and there you see at the microphones, the youth led this showcase. And during this showcase, we were unveiling the animated work that the youth had done. They also held a panel on violence prevention. And again, we were building our relationships. We were making sure that youth were building capacity to be able to really take the lead on this work. And here are some of the ads that we created with the youth. We were able to take the focus group, the interviews actually that we did with a separate set of youth, and take what they said and actually match it to the evidence, and then create this ad campaign that we ran on the public transit system in Philadelphia for about 6 to 9 months. And so these are the other series of ads. And so on these ads, the youth said it would be great if there was information for kids, as well as if there was information for adults. And so that's why you see those two mini paragraphs there, or a couple sentences actually, for people to read. And we found that people really liked them. We actually found that a couple of our ads were actually hanging in people's front of row homes that people had taken from the train, and so they really liked the message. And so we thought that was a sign that we were sort of on the right track. And these animated characters did have an animated little series, so we had short videos as well. And so this is some of that research here, where we took what the youth actually told us, and then we matched it to the Center for Disease Control's evidence-based tips, and that's how we created the animated series. One of the things I'd like to say is that in doing this work, you just never know where it's going to take off. And so someone in Ohio found out about our animated series, and they actually created a summer-long block party with youth, and you can see our characters there. They had sort of taken off the branding for PBCIP, and they took that off, and they used it as part of the Adam Project. And they used this information because they wanted to reduce violence in their city, and they actually held a art contest and a digital animation contest to get youth engaged in something positive during the city. And so this is just that is a clip actually of them talking about the work in Philadelphia and how it inspired them to do some of the work that they were doing in Ohio. And so we did publish on some of that work as well, but you just never know who's going to sort of pick up on the work that you're doing. In addition to that work, I've done a lot of work in faith-based and faith-placed institutions. I've done many projects over the course of my career. I started a lot of work in church-based obesity programs in the Washington, D.C. area for a number of years, and then moved a lot of that work to Philadelphia and did that for a number of years as well prior to coming to Rowan. These are just the names of 6 different projects that I led working on working with faith-based institutions and pastors and community members in order to improve health for these different topics. So most recently, I ran what was called the Getting People in Sync project. It was a pre-diabetes prevention program. We worked with 2 churches, one church in South Philadelphia and another in West Philadelphia. And we were looking to effectuate a small lifestyle change program where people lose 1 to 2 pounds a week over the course of a 16-week program. And what our goal was is to use evidence-based intervention where people were able to watch a reality show series, so similar to The Biggest Loser, but it was done based on the CDC's diabetes prevention program information. And so we're trying to figure out how do we get our best evidence-based information into communities so that they can use it the way they want to use it. And so we worked with a lay facilitator who would just show this video series and then would have a discussion group. And so they were all in their churches. They were church members. They would watch the show. They would have a facilitator talk about what they saw, and they would we collected some data. This is some of the branding from that project. We were sponsored by Xfinity or Comcast to do this work because they had helped create the video series. It was a mixed method study, so we were able to collect quantitative data as well as qualitative data from that work. And we found that we had very high attendance. People attended a number of sessions. So out of 16, they were attending around 13 sessions. The episodes were highly engaging, and people lost weight across the program. And again, this isn't a highly trained psychologist running the program. This is a lay facilitator running and getting similar results, just showing a video and having a group that they run. And so we were able to make some change. And so this is showing some of the weight loss that we were able to show in 16 weeks with a lay facilitator. And then we were able to say that people really enjoyed the different episodes of the series. So those are a few of the projects that I've done before coming to Rowan. And so since coming to Rowan in the last 3.5 years, I've been very active in my research program. And so I'm going to talk with you about a number of research projects and students that have been working with me in my time here at Rowan. So most of my work has been focusing on food insecurity. And so really understanding how individuals are able to cope with food insecurity and food security. And food insecurity is the limited or uncertain availability of nutritionally adequate food. And if individuals are able to acquire that food in acceptable ways. And so I've been working with Dr. Bob Weaver, who's in the department with me as well. And we worked on with the SHOCK team, and we've done some work on Rowan's campus around college students and their academic performance and food insecurity of individuals who have taken our survey through Qualtrics that we sent out 2 semesters ago. About 48% of students said they were food insecure. We imagine that has changed during these pandemic times. We also found that food insecurity increased the odds of being in the lower GPA category. And so food insecurity can impact academic performance, as you might understand, as students might have a harder time focusing, having a harder time being able to get their studies completed. And so this is a very important issue. And Dr. Weaver is leading up that work with the SHOCK team. So a project that I got funded while here at Rowan is called the Fresh Food RX. It also is focused on food insecurity and working with diabetes self-management. We are funded by Horizon Blue Cross Blue Shield Foundation. So diabetes in the US is of great importance. We are looking at data that show that we're spending over $19 billion a year just trying to deal with the complications of diabetes. We know that people that are food insecure have to manage their diabetes, and it can lead to a worsening of their condition if they're not able to afford the right foods to be able to improve their health. We do know that in New Jersey, which is a pretty wealthy state, that however, there are 1 in 6 individuals who are food insecure in the United States, and the food insecurity rate in New Jersey is around 13%. And we know that this data is from 2018, and so we know now with the pandemic that food insecurity has really dramatically risen in the state. And unfortunately, in southern New Jersey, the food insecurity rate is higher than the US national average. So you can see here in this map that Cumberland and Salem and Atlantic counties all have food insecurity rates above the U.S. National average. And Cumberland County is where we were able to do the Fresh Food RX intervention. So just a little bit more. So managing diabetes, as you know, can be very challenging. And so this is just showing you some data about why that is. Individuals that are in lower income households and are many times having to make trade-offs between medications and food, and it causes a lot of stress and coping issues. And so really trying to understand how to support individuals that are food insecure and have a chronic condition is important. So this is some data around Cumberland County. The median household income is around $50,000, but Cumberland County also has the highest prevalence of adult obesity. And we know that if we can make change in people's eating habits as well as support people that are food insecure, we can really mitigate a lot of the complications associated with diabetes. So the Fresh Food RX program is a 16-week diabetes self-management program. And we actually ran this program in a grocery store. So we worked with the local ShopRite. We worked with dietetic students who helped run the program. There's a medical student there who's leading the program. And we talked about a number of different topics that you can see there on the slide. And we were in two ShopRites in Cumberland County, in Vineland and in Millville. And the students went out each week and supported individuals as they were in this group session. And there's another medical student from SOM that was doing some interviewing of one of our participants. So part of the work is that we received some recipes. We worked with the store dietitian to create recipes and a budget list, and individuals received about $125 worth of pre-shopped groceries. And we also gave them a community guide for food pantries, utility assistance, and additional resources that they could use so that they can make sure that there's more money going towards their food budget. We received approval for the study, and as you can see, there's actually Rowan students there taking measurements and collecting data, some of the students from my lab, and we collected all of that data right there in the grocery store, right in the hallway, right outside of the room where we held the study. We did see a drop in BMI over time, over the 16 weeks. We did see a slight change in weight over the 16 weeks, but we did see a slight change in A1C over the first 16 weeks in the first cohort. When we added the second cohort, the results didn't hold up, but I want to tell you that, you know, a drop of A1C from, which is a measure of blood sugar in diabetes, is really important, and that if a person can drop from a 9 to an 8, that is clinically significant. If a person can drop below 7, that is really clinically significant, and people can sometimes come off medications when they get their blood sugar under control. And so we did find through our shopping habits that after going through the program, individuals were able to make more planning while they're shopping. So while it's planning and action is while you're actually shopping, are you able to make changes? And they were able to make some changes during that. So I want to see if this will play.
I just like the idea of having a participant to a one-on-one with my doctor. I like the idea of having like an instructor, a supporter, somebody call, not
So you can see, I don't know if it came through for everybody, but you can see a little bit of the group. That group ended up hanging together after the project ended. Some of the things that they talked about was one person's A1C went from a 14, which is a very, very high as a measure of diabetes, down to an 8, which is clinically significant. Another person described having their A1C blood sugar go from a 11 down to a 9. So we were really encouraged by that work. So some future work that we're doing now is the next study that we've actually been funded by Horizon Foundation to work on ShopRx study, and so we'll be doing similar work with prediabetes. And some of my students that are in the lab have been really, really instrumental in helping to get this project off the ground. Due to COVID, we've had some changes, and so we've been working really hard to figure out how to make sure that this program can be run remotely for individuals to be able to get this same information as well during this time. So we've been testing different technology. We've been looking at different apps. We've been looking at other areas to be able to make sure that we can do this program. And then finally, I want to just talk briefly about some of the work I've been doing in Camden as well. So as you know, we're not that far from Camden. It's just 6 miles across the river from Philadelphia. And it's about 75,000 participants. However, there's a lot of information about the city that we know that there's so many assets that are there. There's over 500 nonprofits, so people looking to make a change in the city. The median household income is around $27,000. And so the purpose of this project was to put together a multi-sector coalition, which we established in 2019. We were funded in 2019 in November as well. And our focus is really to address the lack of fresh fruits and vegetables and food access and food insecurity, particularly in Camden. And so we're trying to generate some income opportunities for urban farming, as well as expand access to healthy produce in a number of local markets and corner stores. This work is multi-sectoral, as I talked about. So these are just all of the partners, which are part of what's called Routes to Prevention. And you can see that there's so many different organizations that are working together in order to see this change. And there's a small picture down there on the bottom that shows the planning team that worked to get this grant successfully through. The funding went to the community-based organization. So a lot of times in community-based work, you want to have that power on the side of the community. And so the funding went to the community-based organization, and they are running that work. The county health department is involved, as well as Virtua Health System has put up a match for this work, to fund this work. So in Camden, the community partner is Parkside Business and Community in Partnership, so PBCIP. They're located in the Parkside neighborhood, right in Camden. So if you're familiar with Camden, they're not too far from Our Lady of Lourdes Hospital in that area. And they have done a tremendous amount of work over decades and decades to really advocate for a number of different community-based programs. As you can see here, they support so many different initiatives. It was established as a community development corporation, and it was really there to focus on housing and commercial redevelopment of the Haddon Avenue corridor. And so they have worked with so many different organizations and schools to do this kind of work over decades. So it was great that they were able to receive the funds and work on this project. The county health department was extremely important in this work as well. They provide a number of services through their van. Oops. And then our previous, the previous slide, this slide shows that Virtua was a part of this project. They focused mainly on providing a lot of support with the food to pharmacy program. They have an Eat Well program, as well as a mobile farmers market. And then we at Rowan are the lead evaluation partner on this work. So we help design this studies that are a part of this work with Routes to Prevention. And so this is the Joint Sciences Center. Prior to the pandemic, our team was meeting at the Joint Sciences Center each week to talk about how to move Routes to Prevention forward. So there we are. There's a couple of my students in the background. You can see in the yellow shirt and the other person with the laptop. So Abby and Acacia worked with me on this project. And we were funded to do 3 pilot research studies. So we're examining urban grower experiences. We're also examining a food pharmacy hospital-based outpatient program with Virtua. We just received approval for that study this week. And we're also designing a study with the Accountable Health Communities program with the Camden Coalition of Healthcare Providers to do a food bucks program with their emergency department social needs work. So community voice is a major part of the work that we do. As you can see, we hear back from the community on many different issues. And here are some of the preliminary results. We held a number of feedback and listening sessions. So we were funded in November 2019. In 1 month, we held a community feedback session to talk about this work and what we were planning on doing. We had my students, there's 2 of my students from the dietetics program, Heather Schisler and Victoria Vanini, they're there, also help co-facilitating some of the feedback that we're getting from participants. We were able to talk to find out about access, affordability, some barriers that people are having. Most of the participants were interested in growing their own food, and they were interested in selling their own food. So that was really great to hear back. And even though education was identified as the most needed resource, people didn't want sort of disease-specific information. They wanted more global information about health, healthy ideas and education. So there's just some more photos from a different listening session that we held in February with another group of participants. And then our last session we held a week before the pandemic, again in Camden, and we were taking more feedback about the needs of the community. So the 3 studies that we have, we just received IRB approval for a study in July, and we're doing that study to look at urban growers' experiences, so their motivation for growing, their health status, their economic concerns, their growing concerns, and so we've been doing that via WebEx. We've also, during this time, created a bilingual cookbook. And so we started this work in May, and the cookbook was released in the middle of the summer. And so we spent a lot of time working with all of our different partners to release this cookbook and then begin distributing it. There I am there masked up with a police officer in Camden who we were promoting that cookbook out, and it's in English and Spanish. We're able to get that cookbook on Amazon, as well as have monthly cooking classes online with Horizon Education Department and some of my students, as well as the Camden County Health Department. So I know this slide is pretty busy and we're getting close to time. I just want you to know that there's so many opportunities that we're looking forward in terms of future directions for this work. And there's just more that will come out of this partnership. And this work is done with a team of people. And so these are, you can see a number of Rowan students are critical to this work and have been critical to getting this work done. So I send a huge thank you to all of them. They're still working really hard on each of these different projects that I've described. So then just to wrap up, Sort of the lessons that I've learned in doing this work. I've worked with so many students, and students have been engaged in so many of my projects, making sure that students have opportunity to meet with professionals, to present their work, to really dig into the data is really important to me. I know that, understanding community history is extremely important, and sometimes people have anger and resilience, and sort of trying to understand that from community members, because before you go in and start working on these issues, you really need to understand the community and where they're coming from. Sometimes community expectations and the urgency to solve these problems that are really entrenched and difficult. It's life or death for people, and they really want this work done. So making sure that those relationships and the communication is strong, and balancing that with academic timelines, because sometimes it takes longer through academic channels to get things done, and community wants to see things happen very quickly. So in doing community-based and community engaged research, you're making sure that you're sort of balancing that time, that there's actual deliverables that people can use. Like, we are able to get the cookbook out, people could use that, right, while we're still waiting for IRB approvals that we just, received and things like that. So you're balancing constantly being able to deliver and make sure that people are able to use the information that you're able to provide in their lives. And then this work goes without a lot of recognition, but I was happy to receive this award unbeknownst to me last October during the American Public Health Association. I received the Unsung Hero Award, and so that was really fantastic for sort of all the 20 years of work in doing community work. And then just some lessons learned. I think by doing community engaged work, you get to ask better questions. You really get to really know and really push and focus on all the assets that are there. There's so many people that are there willing to work with you, and just taking that time to get to know them and really begin to think about new questions. It helps you become more informed as a researcher when you're working alongside people who are really steeped in understanding a lot of these issues. And then, like I said, just in conclusion, I make better informed decisions. It increases community capacity. We, as part of the team, Virtua actually just released, just started having their mobile grocery store that's actually going to be going around in neighborhoods across South Jersey. And so that's some of our Roots to Prevention team, standing with our Virtua colleagues who did a tremendous amount of work, April Shetler, in getting this mobile grocery store bus idea off the ground. And so we're really excited about that. That just happened a couple weeks ago. So this really creates opportunities for innovation, creativity, sort of sustainable ideas. And so I really enjoy doing this kind of work to reduce health disparities. And so finally, mentorship. I just put my students, the students are there. I love working with them. I think mentorship is anyone that you can learn from. And that's really everyone. And so really make sure you have different mentors along your path, but really, those people that are connected and invested in your future, I would say stay very connected to them, because they can help you tremendously. And then finally, when community engagement is done well, it's a blend of science and art. And this is a mural from Camden that I love. It says City Invincible. And when it's done well, it does have both of those components. And those are my three sons. So thank you very much for listening to this presentation. And then I have time, I guess, for a few questions.
Thank you so much for presenting your really diverse background of research and really important work that you're doing. If anyone has questions, please put them into the chat box and I'll be happy to share them. I do have a few questions that came forward. One is, how do you find people to work with and with all these different types of studies, and how can students get involved in your research?
Yeah, so students typically, I'll answer the second question first. So students usually reach out to me if they're interested, and usually I will ask them to submit a resume, and I will also sort of interview them to see if they're really interested in this kind of work. And, you know, depending on if there's openings in the lab, if there's work that they can do, I really look for students that have a high degree of independence, because you know there's a lot of work that has to be done. There's lots of different tasks. I usually partner students up, and so you can see my lab has a number of students in it, and that's because we work in teams because there's so much work that has to get done, and I know how busy students are with their course load. And so I think that's been successful in having students work together in partnered teams to get things done. Um, Many times I'm pretty social, so I'm out talking with people and hearing about what they do and how they do it, and I ask a lot of questions. And that's how I sort of meet people at different places about different projects and talk with them about some ideas. So if there's anyone who has an idea that I'm like, wow, that's really interesting, then I would sort of talk further with them. So I think it's being open. It's always sort of listening and being an active listener. It's being interested in sort of new ideas. And usually once you get started, you know, new projects come your way.
Great. So, and another question we have are how are the challenges different between working in urban areas and rural areas?
That's a great question. That is a great question because I'm more new. I'm more new to working in more rural areas. Since coming to Rowan, this is my first time in my career that I've been working in sort of more rural areas, and I've been surprised that they're very similar. Right? People many times may not have access. You might think that they might have access, but there's access issues in terms of transportation to get to grocery stores. There's income issues. So a lot of there's resource issues, there's healthcare challenges, and so a lot of there's similar issues that are between both urban and rural. And so I'm learning more. My colleagues and I are starting to sort of learn more about rural, and so we're doing more of that research to really sort of dig in. But you can see that the disparities are quite stark as well in rural New Jersey.
So what are the first steps that you take in order to build relationships within a new community? And I guess to add to that is how do you address limited access to virtual sessions?
Right. So I'll answer the second question first. So with the limited access, that's one of the challenges we're having right now. Because when we started that first Fresh Food RX project in the ShopRite, that project had a number of tech elements to it. We were supposed to use smart glucometers for people to measure their blood sugar. People were going to have iPads to connect to their smart glucometers. And the technology became so overwhelming that we just ended up not using it because people didn't have an email address. They didn't have a consistent cell phone, so communication was an issue in terms of having a consistent plan. And so it became really frustrating. So we decided that, we weren't able to use that component for that study. So now with COVID, with this new study with the ShopRx, we're thinking, my research team and I, very deeply about that because, internet connectivity is not universal and people might not have some of the tools that you would think, like a laptop or an iPad or a tablet, to be able to connect into virtual sessions. So we're trying to think about that very carefully in our study and trying to rebudget within our original study to see if we can support the PPE as well as the technology pieces. And what was the first part of that other question? That first part of that question?
The first part of the question was, sorry, we have a lot of, I have a lot of questions coming through. So what are the first steps that you take in order to build relationships within a new community?
I think it's similar. I think talking to the community stakeholders who are the people who are sort of champions for the work, getting to know them, getting to know their issues, having them get to know me and what I'm interested in, passionate about. So I think it's having multiple conversations and really being present and available to really have those deeper conversations and talk about what their goals are and what we can offer in terms of as the university or university projects and services. So I think it's just that initial conversation that you start to have, and then you sort of follow up and continue to be consistent and show up, and that's how these projects usually start.
Okay, and then we're just about coming up to time. So what recommendations do you have for students who want to work or pursue this type of work? And how should students contact you if they want to work with you on projects?
So I think that right now my lab is full, but I think, I'm always sort of, for students that are interested, I think, always send your information because things change constantly. And so, as different student workloads increase and people have to, maybe graduate or move on, then, there's openings that happen. So I say definitely reach out to me at my email and send me your resume and a little bit of your interest and what you're interested in doing. I think one of the ways that students can get involved is really talk with their professors about their interests and what they would like to do. Many of us are very connected. Rowan, even though it's a big university, the professors are pretty well connected. And if we don't know of anyone doing that specific work, we can always reach out to a colleague. I have colleagues all over the country, and they can, sometimes now, a lot of this work is being done remotely. So we're able to really, provide opportunities for students to be able to do that. So I think, one of the things is just really having an open dialogue with your professors.
That's great. Well, I really want to thank you for taking the time and talking with us today. We are at time, in fact, a little past time.
Yes, I know.
But I so appreciate you taking the time. It was a fascinating project. And thank you all for joining us in our Road to Research series, and look for our next invitation. And you can reach out to me if you have any questions for Dr. Vaughn, and I'll be happy to pass them on. All right. Thank you so much. Take care.
Thank you. Take care. Bye-bye.